On the hip side of things, you know, hip replacements generally do very, very well. But we still have some issues with dislocations and instability, some issues with leg lengths and one leg being longer than the other. And so we're using technology, and it's really the first of its kind that uses augmented reality. So I use a set of goggles that overlays the patient's anatomy onto the patient's body and the patient's skin. And it's really a lot like having X-ray vision. So we get a CT scan before surgery. We can template and prototype exactly where we want that hip replacement to be. And then I can line that up with my template that I made prior to surgery to the patient's anatomy through augmented reality. It's almost like having X-ray vision in a sense. And so we can take what are really great hip replacements and we can make them perfect. We can put the implants exactly where they need to be and exactly where we want them. And we think as a result we have better outcomes. If we're looking for a hip replacement to last 20, 30 years, it needs to be perfectly positioned. So it may be that the patient's happy with the hip replacement for the first 15 years of its life, but then it fails because it wears out too soon because the components weren't perfectly positioned. But if we can get them in the perfect position, we can really optimize the longevity of the implants, the outcome of the implants, and we can minimize any associated complications or mechanisms for failure.